All right, let's talk about the signs and symptoms of sleep apnea. This one's out there like crazy lately. There's a mnemonic that goes by stop bang, and all those letters tie into certain symptoms and signs. So we'll talk about that real quick. S is snoring. If you're a snorer, you get 1 point. Usually it's a little tricky. I ask people if they're snoring, and they say, "I don't know, I'm sleeping." So snoring is one. T is tiredness. O is observed apnea. So usually you need someone else in the room to give you the snoring or the observed apnea. Observed apnea means someone watches you either hold your breath or stop breathing. P is pressure. If you have high blood pressure, you get a point. B is BMI, usually over 35. A is age. Age over 50 gets a point. N is neck circumference. For males, it's 17 inches. For males, it's 16 inches. And G is gender. Males get a point. So usually, stop bang, you have it there. If you have 1 or 2 points, usually they say it's low risk for sleep apnea. However, if you're getting 3 or more, depending on which one of the other ones you got a point for, it puts you at higher risk. And obviously if you have 5 or 6, you probably should be getting a sleep study. So let's talk about sleep apnea. Basically there's 2 main types. Obstructive sleep apnea, where your neck or something else, sometimes in kids it's tonsils, block the airway, and you basically suffocate to a small level all night long, which can be a big problem because it makes all kinds of weird changes. There's also central sleep apnea. That's usually after head trauma or certain metabolic issues. Basically, the brain stops giving the signal to breathe. Sleep studies are the way to diagnose these, and there's all kinds of treatments. Set people up with CPAP machines. There's oral apparatuses. Obviously, if you lose weight, sometimes you can, and get the blood pressure down, sometimes you can get around these things. There's a few surgeries that we've sent people for. You kind of hear mixed results. There's a few future therapies that are kind of interesting. I'll talk about one of those in a future video. But what I see is people just feel run down. They run down, they sleep, they're always falling asleep, especially at, they turn the TV on sitting up, they close their eyes. Sometimes even when driving or sitting at lights, which is pretty dangerous. So if you have any of those symptoms, you got to get it looked at. A lot of mood disorders too, and it makes sense if you're not getting oxygen all night long. Your brain misfires all day long, and it can cause, depression, anxiety in kids. Even sometimes kids that were diagnosed with ADHD, they had sleep apnea and they got it treated and they did much better, night and day difference. So just wanted to talk about sleep apnea a little bit. We treat a lot of patients for this. Jon Swetech over at Swetech Medical Center. Be happy to be your primary care doc. Like our Facebook page and check out our website for more good information. Have a great day.